بسم الله الرحمن الرحيم. أنا اسمي الدكتور عادل الجمل، وأنا أستاذ ورئيس وحدة جراحة قلب الأطفال بمستشفى الأطفال الجامعي كلية طب بالمنصورة. أنا دلوقتي يشرفني إن أنا أشارك زملائي الأطباء عن خبرتي مع 2 ميديكيشنز. أول ميديكيشن اللي هو اسمه الفينتولامين، اللي هو في مصر موجود تحت مسمى روجيتامين. الفينتولامين, as all of you know, is an alpha antagonist or alpha blocker, and due to its action, it can be used to reduce blood pressure. One of the major advantages of phentolamine is the on-off action. بمعنى once you start it, it has an action by reducing the blood pressure, and once you stop the medication, the blood pressure goes back to its normal status. The dose of phentolamine is intravenous infusion. You start with 5 and you can increase incrementally up to 20 microgram per kilogram body weight per minute for control of the blood pressure. In cardiac surgery, the phentolamine can be used during cardiopulmonary bypass to control the perfusion pressure during surgery, to maintain the blood pressure at the required level as desired by the perfusionist as well as the cardiac surgeon. Also, it can be used post-operatively to control the blood pressure after certain cardiac surgical types, like post-coarctation repair. Post-coarctation repair and post-aortic valve replacement and post-aortic arch surgery. Usually, there's a tendency for the patient to develop severe hypertension in the ICU, and phentolamine can be used to control this high blood pressure until the patient recovers and you can start oral antihypertensive medication. I have been using phentolamine since 1997 when I was in USA in my training, and then used it in USA and used also in Riyadh in Kingdom Saudi Arabia, and then in 2007 or 8, I remember, it was available in Egypt under the name of Rogitamine, and since that time I have been using this very good and very effective medications. Also, I would like to share my experience with you about another medication which is produced by the same company, which is under the name of Alfaprostin. Alfaprostin contains 500 mic per ml ampoule of Alfaprostin. That drug is also available in Egypt by another company under the name of Prostin. However, the price of Alfaprostin is much cheaper than the other competitor. It's about 1/5 of its price. In pediatric cardiac surgery, we use Alfaprostin to maintain the patency of the patent ductus arteriosus in cases which we name it duct-dependent pulmonary circulation. Duct-dependent pulmonary circulation in cases of severe pulmonary stenosis, in cases of pulmonary atresia, in cases of severe tetralogy of Fallot, also in cases of interrupted aortic arch. In these cases, we need to maintain the patency of the duct in order to keep the patient alive until he got stabilized and get his surgery done.